Hello everyone, welcome to my YouTube channel Pharma Researcher. So this is the video number 10 of Telangana Pharmacist Grade-II exam preparation. This exam is going to be held on the 30th of November 2024 and this is a new series on our YouTube channel Pharma Researcher in which we are covering a total of 10 units as per the syllabus mentioned in the Telangana Pharmacist notification. So in this particular series, we have already covered the initial 4 units. So if you haven't watched those videos, so you can simply go to the description of this video and you will get the link of all the other videos from there. And in today's video, we are starting the unit number 5, which is basically the pharmacology part. So in this particular video, we are discussing the initial few topics of part number 1, which are sources of drugs, routes of drug administration, pharmacokinetics, pharmacodynamics parameters. So these important topics we will be covering in this particular video, and the remaining topics of pharmacology of different classification of drugs, that will be covering in the next video, and that video will be coming today only. So let's start with the syllabus first. So it is the unit number 5, part number 1. So in this particular video, we are covering these important topics like sources of drugs, route of administration of drugs, various processes of absorption, metabolism, distribution, and excretion, and general mechanism of drug action and drug interaction. So this will be covered in this particular part, and in the part number 2, we will be covering the pharmacology of these many different classes of drugs. Now we can simply move to the topics. So here first we can simply discuss different routes of administration, basically different classes of this routes of administration. Then we can simply proceed to the MCQ questions. So first we can see, like, basically there are two types of main routes of administration. First is the local administration or local effects, and the other is the route of administration which are producing the systemic effects. So in this the first one is the local action. Routes can be divided into local action. So local routes are basically, these are local routes. So local routes are basically those which can be used for local designs at accessible sites for drugs whose systemic absorption from these sites is minimal or absent. So basically in these routes there are different examples like the topical routes, which simply refers to external application of the skin to the surface for local action. For example, various creams and lotions, so these are applied externally. Then there are several deeper tissue route is deeper tissue. It also comes under the localized route. So certain deep areas can be approached by using a syringe or needle, but the drug should be in such a form that systemic absorption is slow. For example, in deeper tissue, there are several examples like intra-articular, intra-articular injections. For example, hydrocortisone acetate in knee joints. Then there is intrathecal injection, intrathecal injection. So, for example, injection of lidocaine. So, this is also a type of deeper tissue local route. Then there can be a retrovulvar injection, a retrovulvar, retrovulvar injection. So this is also again the hydrocortisone acetate injection, but it is behind the eyeball. So there are different routes which are given in the deeper tissue, and these comes under the local routes. Then there is another route in local only, so that is the supply arterial supply. So basically there are close intra arterial injections are used. Intra arterial injections are used, and these injections are basically used for contrast medium in angiography, and also certain anti-cancer drugs can be infused in femoral or brachial artery to localize the effect of limb malignancies. Then the other is systematic route or systemic routes. These are very important. So in systemic routes, there can be several types. For example, the oral routes. There can be a sublingual route. So basically, what happens, like in systemic routes, the drug is goes to the systemic circulation. So in this also, we will be having a rectal route. We are having the cutaneous route. The cutaneous route, then we will be having the inhalational route, inhalational route, then nasal route, then there can be the parental routes, and these parental routes are very important. In this, there are several subtypes. For example, subcutaneous routes, intramuscular route, intra venous route, intradermal route. So these are the different routes under parental route, and these all are very important. Then there is another classification from which the question can be asked, basically the enteral and non-enteral routes. So enteral routes. In enteral routes, there are different types. For example, oral route comes under the enteral route, and there is another route which is sublingual and rectal route. These all comes under the enteral route. Enteral route means other than parental. Okay, so these comes under enteral, and the other class is the parental routes, or the injection type of thing. So in parental route, there can be injections. There can be inhalational also given by parental route. Then the transdermal, then transmucosal. So these are comes under the parental route, and the other ones are, the third type can be the topical route. So there can be a several classification. Sometimes the question can be asked from the, like, which of the following is enteral route. So enteral can be oral route, enteral can be sublingual, it can be rectal route, and several other specific examples can be asked, like in intradermal or intramuscular what can happen. So these type of MCQ questions I have included. You will get an idea from those type of questions. Then the second part is our sources of drugs. So basically this is a very basic type of thing, so mostly the question won't come, but if question comes, so you must have you will be aware of these topics. So basically sources can be natural sources and synthetic sources. Natural can be from plant sources, natural can be from animal sources, natural can be from mineral sources. These can be from the microorganisms as well, and also from the human source as well. While the synthetic route involves from the chemical synthesis, there can be other techniques, like through cell cultures, through recombinant DNA technology. It can be hybridoma technology. So these are the different techniques to get the drugs from through the synthetic route. And normally these days, most of the drugs are which are used now are mostly synthetic type of drugs. For example, different quinolones, omeprazole, neostigmine, sulfonamides, and several other drugs. These are the synthetic ones only. So these are the basic things regarding the routes of administration. Again, there can be several other things, like the drug company, like from where the information regarding the drugs can be taken. So these are basically the official and non-official ones. The official drug companies. So in this, the pharmacopias. So basically the information can be taken from pharmacopias, it can be taken from formularies, and also it can be taken from Martindale, which is a complete drug reference book, and also known as extra pharmacopoeia. So these are basically the official sources. There can be several unofficial or non-official companions. So basically in this physician's desk reference will come, physician's desk reference will be there. Then there are several drug facts. There can be several publications or comparisons given in different countries. These comes under the non-official compendias. So these are the basic small information. Now we can simply move to the MCQ questions, which are very important. So here also, like if you can see the syllabus part, so sources of drug, route of administration of drugs, and various processes of absorption, metabolism, distribution, and excretion. So till this part it will come under pharmacokinetics. It is the pharmacokinetics part, and the general mechanism of drug action and drug interaction, these comes under the pharmacodynamics part. So these are the main things. So many times the question is asked, like in pharmacokinetics what are the subtopics, or pharmacokinetics includes what information and pharmacodynamics includes what information. From these title only you will be able to know the different things. Now we can start with the first question. So the first question is, dash is the study of drug and its section. So basically the study of drugs and their action includes the pharmacology. In pharmacology we'll study the different types of drugs and how the drug behaves in the body, and what different actions it is producing in the body for maintaining a health. Then next question is, a drug is said to be an dash if it does not produce any biological response even on binding with the receptor, what in its place it either blocks or decreases the effect of a agonist. So basically what is agonist? So agonist is a molecule which will produce some response. It will produce some response after binding to the receptor, after binding to the receptor. Now what happens is, there is another molecule which is not having any response, like it can bind with the receptor but it will not produce any response. What this particular drug is uh, abolishing the effect of this agonist, which is having some positive or negative response. So this particular thing is known as antagonist. So basically they have no actions. What they destroy, you can say they destroy or they blocks or they decreases the effect of the agonist. So these are the antagonists. Then next question is, dash is the ratio between the dose that can produce useful and the dose responsible for side or toxic effects. So this is the therapeutic index. So here option A will be the correct answer. So basically there will be effective dose 50% and lethal dose 50%. So what is these ED and LD? Effective dose means the drug is producing its positive effect in the 50% of the population. For example, if 100 patient is given that particular medicine, so out of 100 at least 50 people are getting the desired response. What is lethal dose? So lethal dose is like if the drug is given to 100 patients, but in 100 patients the dose of the drug is killing at least 50 of the people. 50 of the people are killed or having a serious adverse effects. So these are the lethal doses. So the ratio of these will be the therapeutic index. Next question is, dash is a habitual use of a psychoactive drug that results due to repeated or continuous use of these drugs, and an abrupt discontinuation of a drug may result to withdrawal symptoms. For example, if a person is taking a habitual drug and it has it is a psychoactive drug, and due to the repeated use of that drug the person is addictive to that particular drug. Okay, and if now he wants to discontinue that drug, and suddenly he discontinue that drug, then there can be several withdrawal symptoms which will lead to again administration of the drugs, and the several things will happen. So this is simply the addiction. So basically when addiction happens, so we should not discontinue the drug suddenly, but we should first reduce the dose, and likewise in this safe process we should proceed to discontinue the drug, not the abrupt discontinuation should not be there. Then next question is, thrombophlebitis is caused by. So thrombophlebitis is basically a condition in which the inflammation or clot formation will happen in a vein. Okay, and due to these inflammation or clot formation, there can be uh, usually it happens in the lungs, in the legs. It happens in the legs, and it results in pain. There can be pain, there can be swelling or redness in the affected area. So this condition is usually due to the intravenous administration of drug, because the drug is simply goes to the veins, and through injection sometimes the vein ruptures, and inflammation or clot formation can happen. Then next question is, what is the important characteristic of the intramuscular route of drug administration? So the important characteristic of intramuscular route of administration is that oily solution can also be injected through the intramuscular route, or simply you can say the depot preparations. Sometimes this term is used, that depot preparations can be given by which route. So it can be given by the intramuscular route. So this is important. Apart from this, the intramuscular injection can be given to the deltoid muscle. It can be given to the deltoid muscle, which is in the upper arm. It can be given to the gluteus maximus muscle, which is in the buttocks, and it can be given to the rectus femoris, which is in the thigh as well. So these are the different sites where intramuscular injection can be given. Next question is, sometimes some diseases can be induced unknowingly by the medical professionals when they prescribe drugs for some other underlying disease. Such diseases are known as. So what happens? If a person is having a disease A, okay, and a medicine X is given to treat this particular disease. So what happens? Uh, by giving this medicine to treat this particular disease, there can be a generation of new disease which is B. So this disease is not due to some other factors, it is due to this particular drug. Okay, so these drugs are known as drug induced diseases. These diseases are known as drug induced diseases, and these drug induced diseases are known as iatrogenic diseases. So here option C will be the correct answer. Means it is not basically due to several medical condition, it is due to the drug which is given to treat some other disease. The next question is, therapeutic index of a drug is dash to its safety. So therapeutic index is simply directly proportional to its safety. Means if therapeutic index will increase, then obviously the safety will also be higher. So for this statement, you need to remember this statement in both ways. Like therapeutic index is directly proportional to what? This can also be asked. So this is the safety. It is directly proportional to the safety. Next question is, which of the following are the special forms of subcutaneous route? The special forms of subcutaneous routes includes dermojet, pellet implantation, chelystic implant. So here option D, all of the above will be the correct answer. So subcutaneous in subcutaneous route there can be several forms. So first is dermojet. What happens in dermojet? So in this dermojet, needle is not used. Needle is not used. Simply in this a high velocity jet of drug solution. Okay, there is a jet which is having drug solution. So a high velocity jet of drug solution is projected from a microfine orifice. Means there is a orifice in that, and it is using a gun like implement, so the drug is injected with a high velocity. So this is in the dermojet. Then in pellet implantation, so drug is in the form of a solid pellet. It is in the form of solid pellet, and it is introduced with the trocar, trocar and cannula. Trocar and cannula, the drug is injected, and this will provide sustained release of drugs over weeks and months. Okay, and for example, the testosterone can be given by this route. Then there can be the third, that is cellulosic implant. So these can be non-biodegradable. Cellulosic can be non-biodegradable, and there can be biodegradable implants as well. So basically, the crystalline drug is packed in tubes. We can simply pack the crystalline drug in tubes or capsules, which are made of suitable materials, and these are implanted under the skin. These are implanted under the skin, and there is a slow and uniform leaching or release of drugs, which can occur over months, and it will provide a constant blood levels. And non-biodegradable and biodegradable, so those which are non-biodegradable, these needs to be removed later on, but biodegradable one need not to be removed because they will be biodegradable within the time. Then moving to next question. So the question is, pharmacology is derived from Greek words pharmakon, which means the drug, and logos, which means. So pharmacology is derived from two Greek words. One is pharmakon. So this words meaning you need to know, that is drug, and logos means the studied in, drug studied in. So here option C will be the correct answer. Next question is, dash are macromolecules present on the cell surface to which the drug molecules bind and cause modulation of their functions. So these are basically the receptors. Receptors are basically macromolecules which are present on the cell surface, and the drug or agonist, these or ligands, we can say drugs or ligands or agonist. So these comes and these binds to this particular receptor, and it will produce some response. Next question is, dash of a drug is the ability of it to bind its receptor. So this is basically the affinity. So the affinity of a drug is the ability, means how strongly the drug is attracted towards the receptor. So that is the affinity of a drug. Next question is, the study of absorption, distribution, metabolism, and elimination of a drug is called as. So the study of these different parameters comes under pharmacokinetics. So here option B will be the correct answer. Next question is, the study of pharmacokinetic and pharmacodynamic features of a drug which is already present in the market is called. So basically, drugs which are already in the market, and for those drugs, if we are studying the pharmacokinetic or pharmacodynamic parameters, so this study is known as pharmacovigilance. So here option B will be the correct answer. Basically, in pharmacovigilance, the adverse drug related things regarding the drugs will be captured mostly. Next question is, substances that bind to receptors are known as. So those substances which bind to receptor are either known as agonist or they are known as the ligands. So here option A will be the correct answer. Next question is, dash is the decreased ability of an organism to respond to repeated administration of administration. So the decreased ability of a organism to respond repeated administration. For repeated administration, it is known as tolerance. So here option C will be the correct answer. But there is a also term tachyphylaxis. Tachyphylaxis. So the tachyphylaxis is also the repeated administration of drug. Tolerance is also the repeated administration of drugs. So basically, what happens in tolerance, if we will increase the dose, then this tolerance can be cured. But in tachyphylaxis, if we increase the dose, there will be no effect. So it is basically due to the uh, capturing of the receptor surface. So the receptor is fully captured by the some drug, and it has no additional thing to wind and to produce the response. Then we need to leave the receptor as it is, and we should stop that particular drug. Once after some time the receptor is fully cleared, then we will give the drug, then the response will be produced. So these are the two terms. If simply repeated administration of drugs is given, for example, in a few of the question papers, this simple term is given. So you can choose either tolerance or you can choose tachyphylaxis. I have also included that question here, so we can discuss that question there. Next, moving to the next question, dash is a ratio between the dose that can produce useful effect, that is effective dose, and the dose responsible for side toxic effects. So this is known as simply therapeutic index. So here option B will be the correct answer. Next question is dorzolamide and timolol are given by. So dorzolamide and timolol, these are the drugs which are given in the form of eye drops. So here option D is correct. Now what is dorzolamide? It is a carbonic anhydrase inhibitor. It is carbonic anhydrase inhibitor, which is basically the drug, and basically the acetazolamide, and the timolol is the drug which is a non-selective, it is non-selective beta 1 and beta 2 drug, and beta 2 blocker. So it is having intrinsic sympathomimetic activity, and these drugs are used basically to treat the increased intraocular pressure in patients with open angle glaucoma. So for these conditions, these drugs are given. The next question is dash are those therapeutic substances that bind and activate to a receptor and result to pharmacological responses that are mimic or similar to naturally occurring substances. So these are the agonists, which are basically the therapeutic substances which will bind to a receptor, and they will activate this particular receptor and produces a pharmacological response that was mimic or that is similar to the naturally occurring substance. For example, few drugs, if in for example in Parkinson condition, there is a depletion of dopamine. There is depletion of dopamine. So in order to fulfill this deficiency requirement, we will give levodopa. You must have known this name, levodopa. So levodopa will go to the brain and it will release dopamine, it will convert to dopamine, and it will fulfill the requirement of dopamine, and that condition can be cured. Means this will be the artificial, or this will be the agonist which will produce the similar action as a naturally occurring substance. So there can be several other examples. Next question is dash is the safest, most economical and convenient route of drug administration. So safe, most economic and convenient will be the enteral route, or you can say oral route. So here option A will be the correct answer. Next question is the main advantage of dash route are that the patient is able to administer drug and any of systemic injection are reduced. So the main advantage of this of oral route is that the patient is simply self-administering the drug. There is only a tablet, so he or she can take the tablet by their own. Next question is which one is an example of oral route of administration? So example of oral route of administration, advantage of oral route of administration. So sometimes complete drug is not absorbed. So this is not an advantage. Economical, sterilization is not required. So it is economical means it is cheap basically, and the sterilization is not required in this. Then unpleasant taste of drugs. So it is also not an advantage. It is a disadvantage, and it is not effective in emergencies. So basically, the drug given by oral route, it will take some time to produce its effect, so it is not effective in emergencies. In emergencies we will use the intravenous route mostly. Next question is in dash the drug is kept within the mouth around the cheeks or buccal cavity where it disintegrates and absorbs. So when the drug is kept within the mouth, around the cheeks or buccal cavity, this type of route is known as buccal route. So here option A will be the correct answer. Next question is, which one of the following is an advantage of buccal route of administration? So the advantage of buccal route of administration includes portal circulation is bypass, means hepatic circulation is bypassed in this, uh, and the small doses are keep in mouth, sometimes inconvenient to keep drug in mouth. Drugs having high molecular weight cannot be absorbed. These are simply the disadvantages. Next question is, the drug is administered in the form of suppositories through dash when patient is not able to take drugs orally and restrictions on eating. So in this particular condition, the drug is given through the rectal route. It is inserted in the rectum in the form of suppositories, and because the patient is unable to take drug orally, or there are several restrictions on eating as well. Next question is, dash shows rapid effect and maintains level of drugs in circulation. So the rapid effect will be coming in the parental route. So here option D will be the correct answer. So parental route, or you can say intravenous route as well. So parental route includes all types of parental administration: subcutaneous, intramuscular, intravenous, intradermal, and intravenous only. The a type of parental route. So sometimes this can also be answer, but on an overall perspective, parental route can be the one. Next question is, which one of the following is an advantage of parental route of administration? So the advantage of parental route of administration include that it has no first pass metabolism. So here option A is correct, and due to the no first pass metabolism, the bioavailability is 100% because the drug is administered directly into the systemic circulation, and this 100% bioavailability is seen in the intravenous route. Next question is, which one of the following is a disadvantage of intramuscular route of administration? So the disadvantage will be it prevents first pass metabolism. It is advantage one. Only 10 ml drug can be administered. So there is a limitation on the doses of drugs. So only 10 ml of drug can be administered. Then the onset of action is fast, uniform absorption. So these are the advantages. So here option B will be the correct answer. Next question is, which one is an advantage of intramuscular route of administration? So the advantage of intramuscular route of administration include there are no GIT related factors. So here option B will be the correct answer. Next question is, risk associated with IV route can be reduced by using dash route. So there are several risks that are associated with IV route. Thrombophlebitis condition can occur. There can be inflammation, blood clots, or swelling. So these can be seen with intravenous route. But by giving the drug through subcutaneous route, means we can say it is a substitution for intravenous route. If there are no emergencies, then uh, the patient can be given drug via subcutaneous route. Next question is, which one of the following is an advantage of subcutaneous route of administration? So the advantage of subcutaneous route of administration include that it shows complete absorption but at a very slower rate. So this is the advantage. So here option D will be the correct answer. Next question is, systemic side effects related to drugs can be minimized in. So in order to have the minimum side effects or systemic side effects, we can use the drug through inhalational route. So here option B is correct. Next question is, why the dash route of administration local to systematic effects can be obtained? So why dash route of administration? Which route? It is the topical route. We can have the local to systemic effects. So here option C is correct. Next question is, dash is defined as the extent of absorption of the drug, availability of drug at receptor sites, and the therapeutic effectiveness of the preparation. So this is the bioavailability in simple terms. Sometimes a question can be asked in different forms. So the definition can also say like the amount of drug that reaches the systemic circulation, that reaches the systemic circulation is the bioavailability of drug, or the rate of extent at which the drug is reaching the systemic circulation, that is the bioavailability. So this definition is also very important. Three definition: one is pharmacokinetics, pharmacodynamics, bioavailability. So these three definitions are very very important. So in case of pharmacokinetics, we will study ADME. Okay. Or there is another term like what the body does to the drug. Like what will when we administer a drug, then what are body parameters that are taking their action towards this particular drug. And these comes administration, absorption, distribution, metabolism, and excretion. Then there is pharmacodynamic. This is the opposite thing, like what the drug does to the body. Okay, so what are the main actions? What are the mechanism of action? What are the different side effects? So these effect thing comes under the pharmacodynamics part. And bioavailability means regarding the drug, like how much drug is reaching the actual site where the drug will be producing its action. So that is bioavailability. Now we can move to next question. So the question is, dash is also known as corpuscular or vascular transport. These two terms are important, corpuscular or vascular transport, because cell membrane engulfs extracellular material by forming a vesicle or saccule, which is destructed by the enzyme present within the cell and lysozyme later on. So basically, this is the endocytosis process, and the another name for endocytosis is corpuscular, corpuscular or vesicular transport. And in this particular transport, the cell membrane, it basically engulfs means there is a this is the extracellular matrix. It will attach, it will engulf this inside it, and it will form a vesicle or vacuole, which is destroyed by the enzyme which are present in the cell, or by the lysozyme. So this is the process. Phagocytosis and pinocytosis, these are the other subtypes of endocytosis only. One is cell eating cell, and the other is cell drinking. Next question is, dash is a carrier mediated transport system that works with faster rate than the simple passive diffusion. So carrier mediated transport is the facilitated diffusion. So basically in facilitated diffusion, uh, in order to transport any material, this process require a carrier protein, which will take that material, and it will reaches to the destination basically. And these type of systems are faster as compared to simple diffusion. Next question is, the factors affecting drug absorption are. So the factors which affect the drug absorption include pH of GIT, not the temperature. So here option A will be the correct answer. Next question is, dash is defined as the hypothetical volume of body fluids into which a drug is dissolved or distributed. So this is the apparent volume of distribution, which is the hypothetical volume of body fluids. So here option C is correct. Next question is, factors affecting the drug distribution are. So the factors which are affecting the drug distribution include the drug interaction, disease state, obesity, surface area. So these are the different uh, factors. Also the binding of the molecule with the receptor or with the protein, albumin. So these are the different factors that that will affect the drug distribution. So here option D is correct. Next question is, dash is the main site of metabolism for most drugs. The main site of metabolism is liver, and for excretion it is kidney. Next question is, a specific group of dash enzymes involves in liver's primary mechanism for metabolizing drugs. So in case of drug metabolism, Cytochrome P450 are the special group of enzymes, and those are involved in liver's primary mechanism for metabolizing drugs. Next question is, which of the following factor is not responsible for affecting the drug metabolism? So the factor which is not responsible for affecting the drug metabolism, so genetic are the factors for metabolism. Humidity is not a factor. Body temperature and inhibitors, these are the different factors which affect the drug metabolism, but humidity will not affect the drug metabolism or biotransformation. So for metabolism there is another term, biotransformation. So this term you need to know. Then next question is, dash are responsible for the excretion of nearly all as well as their metabolites to a certain extent. So these are the basically kidneys which are basically involved in the excretion of drugs. So here option B is correct. Next question is, gastrointestinal excretion is so gastrointestinal excretion is a non-renal excretion, basically not in the kidneys. So here option B is correct. Next question is, dash is a non-selective process which occurs in one direction only. Means it is a process in which the transport is going in the one direction only. So these type of non-selective processes include glomerular filtration. Means in glomerular filtration only once the product is filtered, it will not come back in the same line. So these are the one direction only processes. Next question is, drug movement involves kinetic energy of molecules. So any other source of energy is not required, and the process is known as, so basically the drug movement with kinetic energy of molecules. Uh, Here the other sources of energy is not required, and this process is known as passive diffusion. So here option C will be the correct answer. Basically in passive diffusion what happens, it will involve the from high concentration to low concentration. The drug will move from high concentration to low concentration is known as passive diffusion. If it is the opposite one, like from low concentration to high concentration, so for low concentration to high concentration we will require some energy to move from low to high. So this energy is given in the form of ATP, and this process is known as active diffusion. And in passive diffusion we also say like passive diffusion is a concentration gradient dependent. Means if the this particular scenario from high to low we will be getting, then only the passive diffusion will occur. And active diffusion is not a concentration gradient dependent, is independent of the concentration gradient. Next question is, the example of sublingual drugs is, so example of sublingual drugs includes nitroglycerin tablets. So these drugs can be given sublingually, which is for the angina condition. So option A is correct. Next question is, the route of administration of ceftriaxone is, so basically ceftriaxone is a cephalosporin drug. It is a cephalosporin drug, and it is the third generation cephalosporin drug, and it is given by the parenteral route. So here option D will be the correct answer. Then the next question is, the first pass metabolism by the liver can be avoided by, so by giving with what route of drug administration first pass metabolism can be avoided. So with IV route also we can avoid the first pass metabolism, and with intramuscular muscular route we can also avoid the first pass metabolism. But if different forms are there, so you can simply choose the IV route, because this one will be the most preferred, in which the first pass metabolism is avoided and the whole drug is given in the systemic circulation. Next question is, surface area of the respiratory endothelium is large, causing, so if the surface area will be large, then the absorption will be high and rapid. So here option D will be the correct answer. Next question is, which of the following process is also called as cell drinking? Cell drinking process is pinocytosis, and the cell eating is phagocytosis. So next question is this only, like which of the following process is called cell eating? So cell eating is phagocytosis. So here option B will be the correct answer. Then coming to next question. So the question is dash route of drug administration shows 100% bioavailability. This question is also asked many a times. So with 100% bioavailability, the route of administration is intravenous. Next question is pore transport is also known as. So pore transport is also known as connective transport or filtration transport. So these both are the names of pore transport. So here option D, both A and B will be the correct answer. Next question is endocytosis is also known as. So the endocytosis we have already discussed. It is also known as corpuscular or vesicular transport. So here option D, both A and B is correct. Next question is sublingually used organic nitrate is. So the organic nitrate which is used sublingually include nitroglycerin as well as isosorbide dinitrate. These both organic nitrates which are used in angina pectoris condition are used sublingually. So here option D will be the correct answer. While the isosorbide mononitrate, it is given by oral route only. And the nitroglycerin, it is also known as glyceryl trinitrate, and it can be given sublingually, it can be given orally, it can be given in the form of patches, and also in form of intravenous route it can be given. While the isosorbide dinitrate, it is mostly given in sublingual route, or it can be given by the oral route as well. The next question is the triple V stands for. So triple V is blood-brain barrier, which basically a barrier to protect the brain from several processes. So here option B is the correct answer. Next question is the GFR stands for. So GFR is glomerular filtration rate. So here option C will be the correct answer. Next question is three main ion pumps involved in transport processes are. So basically in transport processes there are three main ion pumps which include sodium pump, calcium pump and sodium hydrogen pump. So these are the three main pumps involved in the transport processes. So here option A is correct. Next question is dash use electrochemical gradient of one ion, usually sodium ions, to drive another ion across the membrane in the opposite direction. So basically, these are the antipodes which are using the electrochemical gradient of one ion to drive another ion. Like basically, there is a movement of one ion from one place to another place. So in order to move this particular direction, the other ion which is present on the other side, it will move from that side to this A side, and the agent which requires the transport from this place to the other place will be happen by the movement of a third ion which is required for the movement of the first ion. Basically it will move in the opposite direction, and this movement will happens due to their opposite movement. Next question is inhibitors that react with an adjacent site and alter the enzyme such that its ability to catalyze a reaction is lost are termed as. So these are basically those inhibitors which react with the adjacent site or alter the enzyme, and they alter the enzyme's activity in a way that the ability to catalyze a reaction is lost. So basically these are the enzyme inhibitors. So these are known as the non-competitive inhibitors. So here option A will be the correct answer. Means basically enzyme A, it is producing some action. It is producing some action. So there can be a competitive inhibitor which is B. So what happens is when B is given, so it will take the receptor side and prevent its binding. So there will be no effect of this A drug. In non-competitive inhibitor, it will directly attack on this particular A compound, and it will not be able to bind to the receptor, and it will decrease or it will disrupt its activity. Next question is physostigmine and neostigmine compete with acetylcholine to bring about inhibition of cholinesterase is an example of, means basically in which the competition is there, that will be the competitive inhibitors only. So here option A will be the correct answer. Next question is adenoreceptors is an example of dash receptor. So adenoreceptors are the G protein coupled receptors types. So here option B will be the correct answer. Next question is which of the factor is responsible for the modification of drug action? So the factors which are responsible for modification of drug action. So these includes the route of administration, genetic factors and metabolic disturbances. All these factors are responsible for the modification of drug action. So here option D, all of the above will be the correct answer. Basically, modification of action means the increase or decrease in the drug action in order to have like if the drugs are given in combination, then the action will be increased. So these are the basic things. The next question is when the action of one drug is enhanced on the administration of other drug, the effect is known as. So when one drug will increase the effect of other drug which is given along with this particular drug. For example, there is A drug and there is B drug. It is producing some hypoglycemic effect, means it will lower the blood glucose level. So and if B is given along with this A drug, then this hypotensive effect will be higher, means we will achieve in lesser time or in some parameters the effect will be enhanced or increased. So these type of reactions are synergism. So option C is correct. Next question is phase 2 metabolism associated with genetic polymorphism is. Basically the phase 2 metabolism associated with genetic polymorphism. The term you need to remember, genetic polymorphism. So this is the acetylation phase 2 reaction. So here option A is correct. Next question is depots of drugs can be formed by. So depot preparation, basically the oily preparations can be formed of the drug by the intramuscular route. This we have studied. Also with the subcutaneous route we can inject the depot preparation. So here option A will be the correct answer. Next question is for a drug given orally, the principal site of drug absorption is. So if the drug is given orally, then the absorption site will be the small intestine. So here option B is the correct answer. Then the next question is pharmacodynamics involves the study of following. So the pharmacodynamics part, it involves the basically mechanism of drug actions. So here option A will be the correct answer. The biotransformation, which is metabolism, distribution and excretion, these comes under the pharmacokinetics only. Next question is agonists have. So agonists are basically those which have high affinity and maximal intrinsic activity towards the receptor. So here option B will be the correct answer. Next question is dash transports one ion across the plasma membrane in the same direction by using the electrochemical gradient of another ion. So these are simply the sympoters which transport one ion across plasma membrane. There is a plasma membrane and one ion move in the same direction across the plasma membrane by using the electrochemical gradient of another ion. So here option D is correct. Next question is which of the following are nuclear receptors? So the nuclear receptors includes the thyroid receptors. So here option B will be the correct answer. And I think the insulin receptors are the tyrosine kinase receptors, and rest we will study the examples. Next question is which of the following are inotropic receptors? So the inotropic receptors include GABA A receptor. So here option D will be the correct answer. Next question is which of the following are G protein coupled receptor? So this we have already discussed in the previous questions. Like the adenoreceptors are the G protein coupled receptors. So here option C will be the correct answer. Then the next question is the receptors for smell, taste, and for blood oxygen, etc. are. So for taste, smell, and blood oxygen, so the receptors are known as the chemoreceptors. So here option B will be the correct answer. Next question is the receptors which detect stimuli of touch on and pressure are touch pressure are. So these type of receptors are known as mechanoreceptors. So here option C will be the correct answer. The next question is phase 1 biotransformation reactions are also known as. So basically in biotransformation or metabolism there are two types of reaction, phase 1 reactions and phase 2 reactions. These phase 1 reactions are known as non-synthetic. These are known as non-synthetic or functionalization reactions. So here option A will be the correct answer. So in these type of reactions, basically a functional group is generated or exposed and metabolite may be active or inactive. Okay, so basically a functional group is generated, it is generated or it is exposed, and a metabolite may be active, metabolite may be active or inactive. So this comes under phase 1 reactions. And in these phase 1 biotransformation reaction, there are several types of reaction. For example, the oxidation, it is the most important or uh, important phase 1 biotransformation reaction. Then there is a reduction, there is hydrolysis, there is cyclization, there is decyclization reaction. These all comes under the phase 1 biotransformation reaction. Then there are phase 2 biotransformation reaction. In phase 2 biotransformation reaction, these reactions are also known as synthetic reaction or conjugation reactions. And in this type of reaction, a endogenous radical is conjugated to the drug. A endogenous a radical, endogenous radical is conjugated to the drug, and the metabolite is mostly inactive except few things. For example, in glucuronide conjugation of morphine and sulfate, conjugate of minoxidil are active. So in few cases it can be active, but mostly it is the inactive form. And in this phase 2 reaction, there can be several examples. For example, glucuronide conjugation, there can be acetylation, there can be methylation, there can be sulfate conjugation, there can be glycine conjugation, there can be glutathione conjugation, there can be nucleoside reactions, ribonucleoside reactions. So these are the different phase 2 biotransformation reactions. Now we can move to the next question. So the question is about acidic drug. True is, so regarding acidic drug, the true statement is best absorbed in the acidic medium. Means acidic drugs are best absorbed in the acidic medium. Basically, the drug is best absorbed in its unionized form. It is best absorbed in its unionized form, and in the stomach, there is acid present, hydrochloric acid is present there. So the acidic drugs, which when it goes to the stomach, it will be having the same environment and acid, so it will be in the unionized form. So in the acidic environment it will be in the unionized form, and it will be best absorbed in that particular environment. And mostly these acidic drugs binding, if I'll talk about the binding, so these bind with the plasma albumin. So here option A will be the correct answer. Now if the question asks for the basic drugs, so for basic drugs, so the basic drugs will be unionized in the intestine. These will be unionized in the intestine because there is a basic pH. Intestine has a basic pH. So with this basic pH for basic drugs, it will be in unionized form, and in unionized form they will be better absorbed. So here for basic drug it will be best absorbed in the alkaline medium, and for acidic drug it will be best absorbed in the acidic medium. Then moving to next question. So the question is repeated administration of drug results in. So this question has been asked in the previous examination. So in this particular question, it is simply saying the repeated administration of drug, and the answer in the answer key will it was the tachyphylaxis. What we can also say, like tolerance is also the repeated administration, but if they haven't specified anything regarding the output or the reason, then you can simply mention the tachyphylaxis if both are given. If only one is given, then it is fine. And if they have simply mentioned the higher dose requirement will fix this condition, then it will be tolerance only. Then if any other, like it is due to the receptor blockage thing, then it will be the tachyphylaxis. Like the repeated administration of drug results in the receptor blockage, due to which there will be no effect produced if we will use the drug again and again, then there will be no effect. We have to skip the drug for fewer days or fewer months, then after that particular time we will be resuming the drug, then it will produce the effect. So this is the main thing regarding these two statements. And if I'll talk about idiosyncrasy, so these are basically the untoward reaction to the drugs, which occurs only in a very small fraction of patients, and and also they do not have any obvious relationship with the dose of drug or with the duration of the therapy. So this is the main thing regarding the idiosyncrasy. Means these are the untoward reaction to drugs that basically happens in the very small fraction of patients and have no obvious relationship to the dose or duration of therapy. So with this question, we are done with the MCQ part of the initial topics. Now I have added few of the definitions which are very important regarding the examination point of view. Few we have already covered in the questions, and few you can check here. So the first definition is regarding the agonist. So agonist is basically an agent which activates a receptor to produce effects similar to that of physiological signal molecule. And they have both affinity and maximal intrinsic activity. Means they will bind with the receptor as well, and they will produce the effect as well. For example, adrenaline, histamine, morphine, these are the agonist example. Then there is inverse agonist. What is inverse agonist? So inverse agonist is an agent which activates a receptor to produce an effect in the opposite direction to the agonist. For example, if a drug is given, it will bind to this particular receptor, and it will produce some positive effect, a positive. But inverse agonist is the one which is, again, it is going to the receptor, it bind to the receptor, but it will produce the opposite effect as compared to agonist. Means it will produce a negative effect. So that will be the inverse agonist. Then moving to next definition, that is the antagonist. So these are the agent which prevent the action. Means if you can see, inverse agonist and antagonist, these are basically not helping the agonist. These are producing opposite effect. But inverse agonist has its own effect. Means it is producing some opposite effect. But antagonist will not produce any opposite effect. It basically prevent the action of agonist by binding on the receptor site and not let the agonist bind to that particular receptor site and preventing its action. Then there is competitive antagonist. These have have affinity but no intrinsic activity. Means they will there is a receptor, they have affinity towards the, if uh, agonist is there and the competitive antagonist is there, then the competitive antagonist will have the more affinity to this receptor, it will bind here, and the agonist will not be able to bind here. So it has affinity but no intrinsic activity, means after binding to this receptor it will produce no effect. Then the next definition is partial agonist. Partial agonist is basically an agent which activates a receptor to produce some maximal effect but antagonizing the action of full agonist. Means it will produce some effect but it will not produce a complete effect, and it will antagonize the action of the full agonist. Then there are partial agonists having regarding the affinity and intrinsic activity. So they have the affinity, they have not complete intrinsic activity, but they have the sub maximal intrinsic activity, which is basically between 0 to 1. Then talking about inverse agonist. So inverse agonist regarding the affinity and intrinsic activity part, these have the affinity but intrinsic activity with minus sign. Means with minus sign means they will produce the opposite effect as we have seen in the definition itself. Then there is a definition of ligand. Ligand is any molecule which attaches selectively to a particular receptor or site, and the term only indicates the affinity or ability to bind without regard to functional change. Agonists, competitive antagonists are both ligands of the same receptor. So these are the few important definitions. Sometimes these affinity and intrinsic part can be asked, or sometimes the definition can be asked. Then moving to the next part, antagonism. So basically antagonism can be of different types, and the drug interaction can be of different types. So basically if you can see the antagonism, so antagonism is uh, a term which is used when a drug molecule, when one drug decreases or abolishes the action of another drug, they said to be antagonist. Means it will decrease or destroy the activity of the another drug, that is the antagonist part. So basically if you can see here in the definition only, or in the example only, the effect of drugs A plus B will be less as compared to if drug A and drug B are given separately. So usually in an antagonistic pair, one drug is inactive, and it will decrease the effect of the another. So depending upon the mechanism involved, these antagonists antagonism can be different types, and from this particular part the question can be asked. So if you can see the first part, that is the physical antagonism. So what is physical antagonism? So based on the physical property of the drug, it can produce the antagonistic effect. For example, charcoal absorbs alkaloids and can prevent their absorption, and can be used in the alkaloidal poisoning. So this question can be asked like which type of antagonism can be seen in case of alkaloidal poisoning. So it is a physical antagonism in which charcoal is used. Then there is a chemical antagonism. So in chemical antagonism, the two drugs react chemically and form an inactive compound. So it can be like in the classification of poison, we will study the chemical poison. So these comes under chemical, means which will bind with the poison. Basically in the antidotes we will study these type of antidotes. Like I have given you the example of three classification: the physiological, chemical, and mechanical antidotes. In that I have shown you, like in chemical antidotes what happens, the antidote will react with the poison, and it will make the poison into an inactive compound. So that is the thing that is happening here as well. The two drugs react chemically and form the inactive product. If you can see in KMnO4 potassium permanganate, so it will oxidizes alkaloids and it can be used in gastric levels in poisoning. Also, if tannins and alkaloids are combined, then insoluble alkaloidal tannate is formed. Then several chelating agents, complex toxic metals, so these are used as chemical antidotes as well. Then nitrites form methemoglobin, which reacts with cyanide radical. Then drugs may react when mixed in the same syringe or infusion bottle. Means few drugs, after combining those drugs, they can while mixing they will be producing some antagonistic effect. For example, the thiopentone sodium and succinylcholine, penicillin G and succinylcholine chloride, then heparin in combination with penicillin or tetracycline or streptomycin or hydrocortisone. So these examples you can read again and you can remember these. Then there are third type, that is the physiological or functional antagonism. So in these type, the two drugs act on different receptors by different mechanism, what has opposite overt effects of the on the same physiological function. That is have pharmacological effect in opposite direction basically. So here you can see the example histamine and adrenaline on bronchial muscles and BP. Hydrochlorothiazide and triamterene on urinary potassium excretion, and glucagon and insulin on blood sugar level. So these are the physiological or functional antagonism examples and types. Then the last is receptor antagonism. In this, the one drug blocks the receptor action of another. So in this, basically the competitive antagonism, non-competitive antagonism, those different things will come under the receptor antagonism. So these are the basic things. Apart from this, there are several combined effect of drugs. There are several combined effect of drugs. Combined effect of drugs. So in combined effect of drugs, we will study basically the synergism part. So synergism, in synergism, basically when the action of one drug is increased by the addition of second drug. So it can be additive one. Additive means basically if A and B drug are given separately and given in combination, they will be producing the same level of effect. These are the additive effect. Then there can be the potentiation effect, the potentiation or superadditive effect. In this, the combination of drug will produce the greater effect. It will produce the greater effect. Means A plus B will produce the effect of A plus effect of B. It will be a higher effect. So basically these are the main things, additive and potentiation, or which is also known as supra additive effect. So these comes under synergism only. So this is the important things regarding the first unit. If you want to read more of the information, then you can always refer to the book like KD Tripathi. And if you want some other book, if you have other books, so you can also prefer those books in which the route of administration is clearly given, the pharmacokinetics parameters, for example, absorption, distribution, metabolism, and excretion, and the pharmacodynamics parameters regarding the mechanism of drug action. So these you can always look into the KD Tripathi book. So that's all for this video. We can meet in the next video in which we will be going to discuss the remaining topics of this particular unit. Till then, thank you very much.